Pawsitive here at the Paws Veterinary Clinic, and we're here with Monty and Dad Mitch. Dad noticed that Monty has a swelling underneath his eye here that he noticed and brought him in for us. He's actually from New Jersey, visiting the area. He likes the fact that we do walk-in visits on Saturdays. Who doesn't like that? But let me show you here. Monty is about a 5 or 6 year old Labrador, and if you look right beneath his eye there, let's see, over here on this side it looks, he's got that swelling. And that swelling is pretty classic for an abscess tooth. He's got an abscess of his carnassial tooth, which is the big molar in the back. And right there, carnassial tooth abscess, big molar. What happens, some dogs will actually see it because they get an infection of that tooth. Now we looked in Monty's mouth and his teeth look great, but Labradors are very mouthy dogs. I don't mean they talk back, I mean they chew on stuff. Monty is a chewer. He likes to chew stuff. He does get bones, and sometimes when they chew, they'll actually bruise that root. And when that root gets bruised, it does become prone to an abscess. And sometimes, like the picture shows here, it may even rupture and get some drainage on the side of his face. So Lisa is counting out some antibiotics. We'll get Monty on some antibiotics, and we use him on the antibiotics for a longer period of time, about 3 weeks, to get that go away. And also we're putting him on some pain medication because he's a little sore. He doesn't like it when we touch that. Dad had talked to his vet at home, and Mitch had said his vet had noticed that he thought one of his teeth were cracked. I didn't really appreciate a cracked tooth today, but we'll put him on antibiotics and pain medication for a tooth root abscess. Try and prevent that from opening and draining. And if it heals up, fantastic. But occasionally these teeth do need to be extracted. We need to pull that. That tooth does not come out easily. It has multiple roots. It's a big tooth. So it's a bit of a project under anesthesia. Sometimes we need to cut that tooth into pieces, almost like a wisdom tooth extraction in people. So carnassial tooth abscess. So if you notice a little bit of facial swelling just on one side. Dad wasn't sure. He thought maybe he'd gotten bitten by something or bumped his head, but a tooth root abscess. Bye now.